We are back on MorningLine. Thanks for joining us. Amanda Bracht is with us, Senior Vice President of Clinical Services with the Mental Health Coop, and they're working with Metro Police. Big pilot program starting at the end of this month that's going to be dealing with crisis intervention teams. This is going to be some mental health counselors actually going out in the field with law enforcement on calls involving perhaps an individual who's having a mental health crisis. And listen, we showed you a clip earlier, one that was from March, where there was a woman with an axe threatening police, and ultimately led with her getting shot. She survived. Another case in May. This was a body cam video that was released by Metro Police. Jacob Griffin, 23, killed in the confrontation with police. How long did they spend out there? You saw the video as well, but they were out there for much of the day with him at a homeless encampment. And his mom had called to say she was worried for her own safety. He had made threats that he had a weapon, that he was just a danger to himself and others. And the police negotiated with SWAT team, but he ended up firing 2 shots at them after a long negotiation, and then they returned fire and killed him. And, again, a situation where I don't think the cops had any choice.
Yeah, I mean, this is a very tragic situation. Not to speak specifically about this case, but I do know that I believe that they were out there for several hours. But in situations where individuals are paranoid, suffering from illnesses like schizophrenia, they are out of touch with reality. They don't really recognize the seriousness and sometimes that what's happening around them. They are fearful for themselves, often due to extreme paranoia. And those situations can get incredibly dangerous, particularly when there is a weapon involved, because you're really trying to engage that person and try to get them to have some insight into some of the paranoia may not be real, but to them it's very real.
And I don't know, it's hard. And to give an example, let's show you the clip. You'll hear the audio. This is not the entire clip, but it gives you an idea of how these officers for hours were trying to communicate with this individual. You see them from behind, from this body cam video. You don't see much of this individual that's in front of them they're talking to, but you can hear some of it. Let's listen in.
And then come talk to me.
Come on, it didn't need to be a nuclear monster. Seriously.
Well, you can stop it at any time. You can come out here. Total control. You have total control just to end all this. Come out here safely. The council talk to you. And go from there. All I'm going to understand is that. All I'm going to understand is that you're the same person I've been talking to for almost 3 hours.
I am a hypnotist. Get off my property.
Can't go away, buddy. Jacob, without your gun, come halfway. You'll see that we still care enough to get you out being hurt. That you can trust our word. Everything we said, you'll see it came true. If you really want us to leave, no, I can't do that either. If you really want us to leave, it's all up to you, man. You make the choices. If you want us to leave, then you have to come out here and talk to the counselor. Then we'll all get out of here. We'll leave you alone. That's why I keep saying this is in your control right now. Yeah, I know it's...
You heard there the gunshot fired. That was the individual they were talking to. Not long after that, you saw the officer with the gun. They approached, and when there were a couple more shots fired toward him, they had to return fire. You did hear him say, and again, I think these officers, you could hear him, look, you're in control, all you have to do is come out, and then he said, if you get out, we can get you with a counselor. So I guess if the crisis intervention co-response team was up at this point, which it's going to be at the end of this month, a counselor would have been with them. How might that have changed this in any way? And I'm not saying it would have. I think these officers, again, did the best they could.
Yeah, I mean, I'll be honest, I don't know if that would have changed this situation. This is a true tragedy that in hindsight, I would have loved to seen more outreach prior to police even getting that call, and the mom having to make that call. I don't know what happened in the years prior to that call. And unfortunately, schizophrenia, which I'm just making an assumption is likely what this young man suffered from, is a devastating brain illness. And you heard him reference, I'm a hypnotist. that, it's not uncommon for people who suffer from that illness to think that they have special powers, that they, or that they're getting messages from the government or from secret societies that are controlling their actions. And, he thought that they were encroaching on his land. So he clearly was incredibly paranoid, out of touch with reality, obviously fearful because he's not willing to come out. I think those officers did they did everything that, in looking at it from that clip, that a counselor would have done. They were calm. They were trying to engage with him. I believe one officer said, "We care. We want to get you help." But unfortunately, his illness had taken control of him.
So in cases like that, I was about to say, as you describe it, I mean, if someone's schizophrenic and has that attitude, sometimes you cannot reason with them. These officers were trying to reason with this individual. But if he's just on another planet somewhere, I mean, it's not going to work. So I don't know. With time, and they were out there for hours, sometimes it's just going to happen like that, no matter what. But the hope is in other cases maybe, and you do say, it can take time, right?
Yes.
There can be no rush. And so, and that's a lot for an officer who's doing everything else. With a counselor there, maybe can assist if we're talking about 3 or 4 hours of negotiations. We hear about barricade situations all the time. You may go on some of those. So when it's that long, I imagine help is welcomed.
Absolutely. And we, unfortunately, these two cases are the ones that ended in terrible tragedies. But these types of scenarios that don't end in tragedy happen in our city just about every day, where we are able to have that moment of engagement with that person, even that person who has schizophrenia and is out of touch, to where they're like, wait a minute, I hear you, I'm willing to get help. This is the most extreme, where unfortunately that did not work. But we are able to talk individuals down and get them engaged and get them to treatment. And sometimes it's the clinician who's able to do that. Sometimes it's an officer. I believe in this situation, or in many of these situations, particularly barricade situations, it's SWAT negotiators who we've been training for years and working very well with. They are some of the most gifted individuals I have ever seen at de-escalating situations.
But SWAT doesn't always respond to every call, of course.
SWAT doesn't have the capacity to respond to every single call. So again, we hope with this partnership is that it's both. It's that you really assess the individual situation, and if you need to take extra time, you're going to be able to take that extra time. These situations can go on for hours. And our hope is with this, this partnership, we will be able to do that on those calls that need that time.
And this partnership, I guess, the chief obviously is for this, and it's been discussed for a while. They just appropriate some $800,000 to assist with that, I guess, in the recent budget. I mean, can you talk a little bit about the monies and how this works out? Because a key that it's being taken seriously, one key always is if Metro Council is giving you money, it should be, meaning that money's tight and they're trying to be judicious with it. And I think this is certainly something a lot of people would agree is a good idea. But they're putting their money where their mouth is right now. Now, I suppose more money the better, but this $800,000 joins some funding that's already been there?
Yeah, so I should clear up. So the $800,000 is actually to help make sure that there are treatment beds or treatment resources for folks, because the co-response funding is coming from a different pot of money.
Clarify that for me, because I just saw it was going to the co-op, and I thought, okay, that's maybe an umbrella thing.
Yeah, so the co-op has been providing 24/7 walk-in center services, meaning if you have a loved one who's having a mental health issue, you call us, we can either send transportation to come get you and bring you into our center, or their family can bring them in. We currently see about 250 to 270 people every month in that situation. As our city continues to grow, the need for that service has grown, and we had a funding deficit. So thankfully Metro said, we're going to help with that funding deficit, knowing that this project was going to launch and that we will likely be identifying even more individuals who need help. We need to make sure we have the resources on the back end.
So setting the foundation there. But the co-op and the 6 or 7, did you say how many? Will be 6 counselors initially going out. That's part of their day, instead of being at an office or, meeting with people away from, their homes or going to the homes. I don't know how that works. They're just doing their job with cops.
That's right.
Same thing. So it's not like that's necessarily costing you more.
Well, the city is giving us funding for those particular counselors because we have to they are moving over from our traditional crisis team, but we have to backfill those.
Of course.
Those openings
To keep that.
right.
Okay, and then PD is going to provide you with the bulletproof vests?
Yes.
They're heavy and hot.
Yes.
But they're crucial.
Yeah.
You've got to wear something like that.
Yeah.
So, all right, I just think that's awesome. It kicks off on the 28th of this month. It's been a long time in the works.
Yes.
But the idea of this is, hey, let's see how it goes. I don't think there's any doubt that it is a positive. The question is, will it need to be modified as it moves forward?
Absolutely.
But if it works, and we just have a minute left, the idea then I would imagine would be, as you said, to expand it to every precinct.
Yes.
It doesn't mean, and there will always be a set core of officers that are assigned that. Not every officer is always going to have a counselor, obviously.
Right.
But for those types of calls.
Yeah, those types of calls, the hope is that we will have officers in every single precinct that are designated as CIT officers with a clinician.
And you would say every single day, Metro PD in a city this size has at least a handful of calls like that. Every day.
Absolutely.
Every day.
Yes.
Not always like the ones we showed you video
Right.
of just now, but anything that may involve someone having a mental crisis.
Absolutely. They're calling our office every single day.
Yeah. Well, I think it's a great idea, Amanda. I think it's the future of policing to some degree on these types of calls. So we'll be following up with you. You got to come back on with us once it gets rolling. Tell us how it goes.
Be happy to.
Thank you so much for coming on today.
Thank you.
Really appreciate it. We'll take a break. I'll be back with a programming note right after this. That's great.